Hi, I'm Holly Archer, and this is The Fold Out. I am here today with Dr. Plabon Ismail, and we're going to be talking about rTMS, or Repetitive Transcranial Magnetic Stimulation. If you haven't heard about it before, you are not alone. So today we are going to unpack what rTMS is.
So when they did brain scans for people with depression, what they found out was that there are certain parts of the brain that are hypoactive or less active. And one of the ways to stimulate these parts of the brain is by stimulating it with a electric impulse. The way I try to explain it to my patient is that imagine you are living in a city and there is a power outage in certain parts. And the only way you can get the lights up again is if you provide certain amount of electricity to that part and get it active again. So rTMS works very similarly. We take a magnet and then we place that magnet close to your scalp, and that magnet generates a very focused electric field that only stimulates the part of the brain we want to stimulate it. So in depression, for instance, it's the dorsolateral prefrontal cortex that we are stimulating. And since the stimulation is so focused, again, the side effects are much lesser.
Okay, whereas with ECT, it's going to be a more general...
Yeah, so ECT is basically a controlled seizure, right?
Okay.
So people are put to sleep with anesthesia, and then we have a controlled seizure in both side hemispheres of the brain. Whereas with rTMS, you are awake throughout the whole process, and it's a very focused area that we are stimulating. And once you stimulate that area, it's like going to the gym. You won't see muscles the very first day, but if you keep at it, that area of the brain that is hypoactive eventually becomes active and starts interacting appropriately with other parts of the brain.
And how long does the treatment last? So if you're having an rTMS treatment, how long do you have to be treated? And then how long is the effect going to last afterwards?
It's a great question. So most of the time, the treatments are once a day, and that goes on for 4 to 6 weeks.
Okay.
Some people respond very well, and after the 4th week, they're like, I'm doing great, I'm done. Some people will just take a little bit longer. And then we have maintenance treatment, just like ECT, where you come back once or twice a week for a few more months to just get boosters, to make sure that you carry the gains that you have got. A lot of people get rTMS and then they go back to their family physicians or their psychiatrist and they continue on their regular meds, and we never see them again.
And what percentage of people would you say it works for?
When it comes to treatment-resistant depression, I would say that 40 to 60% people will actually show some level of remission. That means their symptoms decrease by at least 50%. And then there are others, and the number vary between 30 to 40% who have full remission, where they are without symptoms of any depression.
Now, are there other mental health issues that we treat for, or is it just depression at this time?
Yeah, so at this point, we are just treating depression. We are a pretty new program. We hope that in the future, we are able to treat also for smoking cessation and OCD. We do have the machine that can do that. Apart from that, there's a lot of research going on with rTMS. People are looking at schizophrenia, PTSD, anxiety disorders, and there's a lot of medical use of TMS as well, such as Alzheimer's, Parkinson's, any kind of cerebral vascular disease, and so on.
What's the age range for rTMS?
We treat anybody who is above the age of 16 with rTMS. There is an increasing body of evidence that they can be used in younger people.
Okay.
But then again, they are not approved by the government authorities. So we are treating only 18 and above.
Great. Now, you said earlier that we have the machines to do smoking cessation as well as OCD. What do you mean by that? What does each machine do, and what's the difference between a machine that's going to help with depression versus another mental health issue?
Absolutely. So like I mentioned, that it's highly focused, right? So our machine has these 3 helmets. The first helmet can target the dorsolateral prefrontal cortex very well. And that is what it is primarily used for, is for depression. The other helmet we have is also used for smoking cessation, and it targets the insula. And then we have the OCD helmet, which targets OCD. So we do have the mechanisms. As mentioned, we had like a growing program, and right now our focus is on depression.
Great. So in terms of who can access rTMS right now, how does our program work, and what are the other programs in Ontario that people are accessing currently?
Right. So if you go to the Waypoint website, we do have a referral process. We do require like a nurse practitioner or a family physician or a psychiatrist to refer the patient to us. There are two streams. Either you can refer people to ECT or you can refer to rTMS. It doesn't matter which program you get referred to, you get a consult from a psychiatrist to see if you're appropriate for this particular program or not. And once we see the patient and we talk and look at the needs of the patient, we might decide that, hey, you were referred to rTMS, but I think ECT is better for you. Or we get a referral to ECT and we say, hey, no, rTMS looks like a better option for you. Again, a lot of people don't know what the processes are and the differences are. So we take this opportunity to educate them and also look at how it is more patient-centered. And then you get a referral. And once the referral is completed, then you go to either stream. With rTMS, we usually bring the person in and we give them a taste of what rTMS looks like. We call it adaptation. And then the patient decides whether they want to continue with the treatment or not.
Okay, so you're treating inpatients at the hospital, but obviously also people external to the hospital. You don't have to be affiliated with Waypoint currently to get treatment. Is that correct?
That's correct. Absolutely. So a lot of our referrals comes from the community physicians and people that are within the region.
And how far along in your mental health journey do you have to be? If somebody is newly experiencing a severe depression, would they have this as an early option, or do you have to try an antidepressant first or be sick for a certain length of time before you're eligible to participate?
Absolutely. So one of our intake criteria is that you must have at least failed one antidepressant and or psychotherapy before we can consider you for treatment. We find that those are the people that respond the best to rTMS.
And are there any risk factors with rTMS itself?
There are minor risk factors. So, I mean, one of the risk factors that people are well aware of is seizures that can happen during rTMS. However, the research in rTMS has come so far that now we know how much to stimulate the brain so as not to induce seizure. So the recent numbers are much, much less. So it's like 0.02% of population that can have a seizure. We do screen for seizure disorder in our patients when they come in to make sure that even if they have seizure, it's well controlled and managed, and that's not a contraindication. But again, we are very vigilant of any side effects. The other minor side effects people have is a little bit of scalp irritation. So when you get this treatment, it feels like somebody's knocking on your head slowly. The first 1 or 2 weeks, people do say that sometimes that can be a little bit irritating. Mm-hmm. However, they get used to it afterwards, and we do not have too many complaints around that. Right? The protocol that we use at Waypoint is only 3 minutes long. We are very fortunate that we have a machine that can use a specialized pulse generation that is only 3 minutes long. Before it used to be 30 minutes. So again, I can understand how it is difficult for some people to stay still for 30 minutes.
Oh, yeah.
But with the 3 minutes, they're in and out. It's like you're watching your favorite music video and you're done.
Do you have any patient stories or experiences that have really inspired you or made this work feel really worthwhile in this new endeavor we've taken on at Waypoint?
Yes, there are several actually. One of the things I find with most patients is that they feel that it's the end of the way for them. Once they have tried a few antipsychotic, they had too many side effects, or they have even tried several modes of psychotherapy and it hasn't worked for them. So a lot of time they come quite hopeless, and we tell them, listen, let's hope that we can get you better, and these are our results usually. And then after they get the treatment, it's almost like a light bulb going up in their head, like somebody has described it to me. And then they do reach out to us afterwards saying that, this is the best I have ever been, or this was without side effects, or, I'm going to come every couple of years and see if I can get another booster treatment completed or to get some level of maintenance. So there are lots of stories of success and people feeling that finally they have some hope.
Why does stimulating certain areas of the brain help? Do we know why that's beneficial?
Absolutely. So in diseases like depression, we know that there are parts of the brain that are less active, right? And one of the ways to directly stimulate these parts of the brain is by providing them some level of impulses and then getting them to reactivate again. The other issue is that a lot of time when this particular areas of the brain, like in depression, the dorsolateral prefrontal cortex, which is responsible for a bunch of things, which is emotional regulation, some level of cognition, decision-making, and so on. When this particular part of the brain does not work, it affects your whole life, right? So when you provide some level of impulse to this particular part of the brain, they get reactivated over time. And not only that part gets activated, it also strengthens the network that it works with other parts of the brain. So again, it's a wholesome effect that targets one part of the brain, but the effects of that is throughout the network of what we understand, the network of depression.
You mentioned previously that the research around rTMS has been around for about 30 years. Is that correct?
That is correct.
Now, some people still seem to see it as experimental or something that's new in the field, and that causes a bit of anxiety. Has that been your experience with patients? And when it has happened, how do you alleviate their concerns?
So interestingly, we have two groups of people. One group that is very anxious, saying that, hey, this is new. And then we socialize them to the idea of like, it has been around forever. It has been approved for depression. It has been approved for smoking cessation, OCD, etc. We have the other group that are super excited to try something new and novel. They usually come and say, you know what, I have seen every single psychiatrist in the region. I have tried every single antidepressant. I have been in psychotherapy for like 10 years. And like, this is the new best thing, and I want to try it. The important thing to remember about rTMS, like I said, is that it has been around. So when I say that, what I really mean is that we know that it is safe. And that is the first thing that we tell patient, is that, hey, we have a lot of experience tweaking with this. We know exactly what parameters we are going to use. And we know that in the environment and the controlled environment we provide this, it is particularly safe. Word of mouth is big. So we have a lot of patients that go and tell their families and friends about rTMS. So then they get referred and come here. And again, they're also excited because they will say things like, this is the only thing that have worked for my relative, or this is the only thing that does not cause too many side effects for my best friend. And that is why I'm here.
Like if you could have one thing that you could tell people about rTMS and share with them, what would you want people to know about rTMS?
So what I would tell them is that, I understand that it's a journey with mental health and depression. And sometimes part of the illness is also to feel hopeless. So a lot of time people do feel hopeless when they're going through their depression journey after they have tried a few things and it hasn't worked out. What we are learning now is that the more you try, the higher chances are that you will go into remission. And rTMS is one of those things that is available now. And again, this gives you another opportunity to try something different that will allow you to go into remission and decrease your symptoms of depression.
Well, Dr. Ismail, thank you so much for all of the information today. I can't tell you how much I've learned, and I know for many people, having another option that provides hope and that encouragement to keep trying, even when it feels like you've tried everything. What a gift to have something else to offer people to try. And the fact that we have more research coming, both here at Waypoint and external to Waypoint, I think is extremely motivating for everybody in the community and in the region. This has been really helpful. So thank you.
You're very welcome.
All right. And I'm sure we'll have you back here in the fold again. So thank you so much for joining us.